Medicaid claims. We're not collecting Medicaid claims right now, but we did want to mention that in the first phase of Atlas, we collected the claims data. We'll be focusing primarily on the treatment facility survey, which is administered at the individual facility level. And that will be the primary task we're asking providers to complete in this round of Atlas. We'll also talk about the patient experience survey, which is fielded in conjunction with provider sites. But you'll learn more about that in the coming slides. So the TFS, again, the treatment facility survey, I think we've been referring to it as the Atlas survey. You will get an email in late October. I don't believe we have the exact date to share with you yet, but this survey will be done electronically. Many of you have received a reference copy of the survey, and that was to enable you to see what type of questions are being asked and to prepare for which individuals at your facility will need to supply information. But you'll get that survey. It will be slightly different than the reference copy. For example, we did include some telehealth questions in the new survey that you'll get. So that'll be done at the physical address level. So if you have multiple levels of care co-located, so you have an outpatient and a residential at the same site, you'll just do one survey and it will include both levels of care. And we have allowed you to choose to answer questions either the same for both levels of care or differently in some cases. And so those questions, Carolyn covered our national principles of care, but they're asking, it's asking how you perform across those 7 different principles of care when it comes to things like access or care coordination or recovery support services you might have on site. So the next source that we use for Atlas, and I encourage you, if you haven't yet, to go on the website. So just go to treatmentatlas.org. You'll be able to see an example of facility profiles, which will be really similar to what will exist when we roll this out in New Jersey and Florida and Pennsylvania and all of the new states coming on board. The patient experience survey includes we included 7 measures. There are CAPS and echo measures that are broadly used in other areas of healthcare. We also have a patient narrative feedback response. So we're asking about, what was the experience with access to care like? Do they have access to behavioral health? Folks are rating their experience at a facility on a scale of 0 to 10. We're looking at whether they felt respected during treatment. Were friends and family involved? How much did they perceive being helped by treatment? Improvement in ability to function. And the patient narrative is that free text response. So you'll see these 7 questions. If you look at a facility profile, one side will summarize these questions based on all of the patients who have completed that survey. And then the other side will have that narrative feedback, which offers a little more context to those responses. So for details on this piece, in order for the patient experience feedback to show on a profile, the facility has to have at least 20 responses. So we're ensuring we have a threshold of feedback so that it's not biased or either way. We initially conducted a smaller pilot before rolling out this patient experience survey in our first cohort of states. And we learned a lot from that. So we're trying to, we're working on packaging some of the tips and tricks and the feedback from facilities that did this last year. And we'll be providing that to you in a patient experience survey toolkit. So that's something you'll see, I believe, next month. But these are, the natural language processing software. So I think we talked about this in last month's webinar, but in case you didn't hear how this works yet, when someone completes a review on Atlas, it goes through 2 different steps. So the first step is going through this natural language processing software. which I think we should rename because it sounds very complicated. But essentially what it does is it ensures that someone's not sitting down and sending 10 surveys from one IP address. It also looks at whether there's profanity used or if someone mentions a specific individual. Those are things that we pull out. And so you'll see that piece is the first step. There's also a human review. So after it goes to the software, someone at Shatterproof looks at each review before it's posted to the website. And then finally, we will have an option where you can log into your profile and you have the ability to flag any patient feedback responses that you feel are concerning and warrant additional review. So that's important to put out as well. All right, so we're going to start our next poll. Oh, there we go. So if you could go ahead and answer that.
Thank you all for chiming in. And as you fill out the poll, if you have any additional questions, feel free to drop them in the chat. I'm monitoring the chat, so happy to respond to quick items or save others for our Q&A at the end.
Great, just another 30 seconds here to finish the poll and we'll go ahead and close it out. I am seeing that so having them fill out the survey as part of the discharge process, that's something that a lot of the facilities in our first cohort of states did find the most successful. So great to see that as well. And then emailing or texting them the link to the survey post-discharge. Especially as we move towards having more telehealth available, I can certainly see how that would be helpful to send electronically. So thank you so much for that feedback. So we won't spend too much time on this piece, but we did want to mention the claims-based measures. As providers, I'm sure many of you are familiar with claims-based measures. You probably deal with these on a regular basis as you report to your commercial payers that you're contracted with. We are currently in the midst of working with Mathematica on some claims-based measures work. So ensuring that we are looking at measuring the right things in a fair way and looking, of course, at new measures that are coming into this space. There are not a lot of OUD measures currently being used. So we're undertaking some really thoughtful work on that. And we're happy to answer any questions, but you'll see more information on this in early 2022 on what we'll be doing with the claims-based measures, inclusion in Atlas. So how are stakeholders currently using Atlas? So first, using Atlas as a tool on helpline websites. And I love to point this one out first because we have the state of Louisiana was one of the first to incorporate Atlas as a resource for their helplines. So all of their 211 United Way centers, their crisis lines, their gambling line, they're all trained on how to use Atlas to locate care. The Supreme Court also added it to their resource database. So their judges are using it, our FINS officers, which are social workers working with at-risk youth. So in addition to that, we've started to work with hospital associations and others to try and get Atlas out there as a key referral resource. And there are other states that are doing that as well. And August and Carolyn, feel free to chime in with any other examples you wanted to share there. Let's see here. So integrating Atlas is a component of the county warm line. That's Delaware, right? Yeah, thank you. So Delaware is doing that as well. And I know that we've talked with other states about this, but definitely something we're hoping to see in these new states when the website goes live next year. Great. So I think, Ankit, am I going to transfer this over to you?
Yep, thank you, Leah. And good afternoon, everybody. I hope everyone is doing well. And thanks again for being here with us this afternoon. So as Leah was mentioning, the benefits of Atlas, From a provider and from a facility perspective, there are a few benefits here that I'd like to cover. So first, being able to ethically market facilities to patients, payers, and grantors alike, connecting with other resources and partnerships, showing your commitment to state-sponsored initiatives. That's one thing that we've seen in many of our states, different initiatives around quality improvement and access. Also leveraging with payers for value-based contracts, demonstrating your quality and transparency to potential patients, staff, and partners, and gaining the opportunity to partner with the Atlas team for local, state, and national presentations. We've done that quite a bit. I know I partnered with my counterparts and colleagues in West Virginia, and Leah and Carolyn have done similarly as well. And last, and certainly not least, accessing free data about your facility, including benchmarking and patient experience information. As I think you may have heard last time, our portals were sort of undergoing a bit of a change there in a good way. And so we're really excited to sort of bring those to you so you can really understand how is your facility performing across other facilities in your respective states as well. Next slide, please. With the next slide, please. Perfect, thank you. So looking at the benefits of Atlas from a patient perspective, so they'll be finding care that really meets their unique needs. We have an assessment on Atlas that if you haven't seen yet, that really I think will be certainly very helpful as they begin that journey for high quality treatment. They'll be able to compare the quality of facilities to choose from. We have a compare feature, so if they find a couple of facilities that might fit their needs, they can, in a sort of a very clear, streamlined manner, understand what are the differences. They can leave meaningful reviews of their experience. They can also read reviews from others' experience at the facility. They can also find information and support to help others navigate the treatment system. And finally, they can build trust and transparency with the ability to leave a review. Next slide, please. So as we talk about, from a provider perspective, we've gotten some really good feedback, and you can sort of see it listed here. I won't go through every single quote, but just a couple that we thought were notable. They're learning how to measure up to other providers. There's an opportunity to demonstrate how unique your facility is, and they can make it easier for people to find your facility in their search journey as well. And especially during COVID-19, helping to make finding addiction treatment easier in this sort of unprecedented time that we've all been in. Next slide, please. And so we've also had the opportunity to get some really good feedback from others in the field. So for example, Tom McClellan, Regina LaBelle, and Leah Binder. These are videos that once we send out the content, you are more than welcome to see sort of what they have to say about this. There's also a link at the top that's in orange that you can click on as well. But we've been really sort of honored and lucky to have folks such as these individuals listed here provide some really good feedback on Atlas also. Next slide, please. So one of the aspects of Atlas is technical assistance and improving quality. So late last year, just about a year ago, as a matter of fact, we launched our continuous quality improvement learning series. And this was an opportunity for us to engage with our provider stakeholders in our states and provide some tools as it relates to technical assistance. So we had key quality improvement topics, and we always try to relate them back to our national principles of care as well, and how those sort of are applicable within Atlas. We've had speakers present on resources that are available to providers, and the overall sort of overarching focus is sort of building and sustaining strong quality improvement infrastructure at facilities. And then last but not least, discussion on how to best implement practices to improve quality of care we've gotten some really good feedback from folks who said, the content can be helpful, but having sort of facility-specific strategies on how to implement best practices is very useful. So we've leveraged, our provider network, where providers have themselves talked about sort of a quality improvement project they undertook, how they went about it. And so that was incredibly valuable for other providers on the call that were able to sort of benefit from that experience. And these sessions are free, and the resources featuring from providers and various subject matter experts in the field. You can go to our site. It's treatmentatlas.org/CQI. And you can see, I think on the next slide, it'll be listed the various past sessions that we've had as well. Next slide, please. Yep, so here we are. Thank you, Leah. So this is just sort of a flavor of some of the topics that we covered last year. As I mentioned, we've had subject matter experts, we've had provider panels, we've had consultants with really decades of experience in this space provide their experience, insight. So as I mentioned, and as I think Carolyn just included in the chat, feel free to visit the site and you can watch the pre-recorded sessions as well. And we'll also have some upcoming sessions later on this year also. So on this slide here, you can see upcoming provider roundtables. So these are meant to be monthly webinars to really help provide updates on where we are with the project, with treatment providers, and other key Atlas updates. And also we want to answer any questions that you all might have also as we continue our work in the respective states. Each webinar will end, as you will with this one, with a question and answer session, and recordings of the events are always provided to those that were unable to attend. And below here, you can see the roundtable schedule with the registration links listed. So if you haven't already, please register for the upcoming sessions. So as we mentioned, please check out treatmentatlas.org, familiarize yourself with the site, and you can really understand how a platform works. During the Atlas survey collection, we will have a designated help desk that you can outreach to. So based on the question that you might have, you can send the help desk a message, and then internally we'll make sure that we get that question to the appropriate resource so we can get back to you in a timely manner. Also, your state engagement directors are always available as well. And so, for example, I'm working with Delaware, Massachusetts, Pennsylvania, and West Virginia. My colleague Leah is working in Florida, Louisiana, New York, and Oklahoma. And Carolyn is working with North Carolina and New Jersey. So you should see our names and email addresses here. So please do not ever hesitate to contact us with any questions that you might have as well. So I think that's it for the formal slides. Carolyn, I can turn it back over to you.
Sure. So thank you so much, Angad and Leah, and thank you all for joining us today. So at this point, we'll open it up for questions. If you have any, you're able to unmute yourself or put it in the chat. If you'd like to hop off now and get some of your time back, we certainly welcome that. We will have a poll open for those who wish to leave early, but for those who wish to stick around, please feel free to jump in with your questions. We're really here to be of service to you. And I'll just note while you're thinking of questions that we will send out the slides, recording, and links to register for future roundtables in follow-up. And I'm so excited already by the results that we're seeing from the polling.
Hey, Carolyn, this is
Hi,
Jim. The question that I had, so the survey that would be going out in October for the client feedback, we tend to have folks in our service for a long period of time doing recovery management work. And is there anything to sort of check the pulse with people? It sounds like it's geared more towards discharge. Is there anything to check the pulse with people that are, kind of long-standing in the program?
Great question. That's actually an excellent point. I'm glad you asked. So you can administer the survey at any point during treatment. So for instance, if somebody's going to be in outpatient for the foreseeable future or in residential for several months to a year, you're welcome to administer that survey at any point. And the way that you can see the change over time is that right now we're in the process of determining how we'll retire old reviews. So that way, if a facility's quality gradually shifts over time, you'll be able to see that in the trends of the reviews. So certainly if patients are in long-term care, for instance, if you want to do a 3-month check-in or a 6-month check-in and have them complete it, then that's completely acceptable.
Outstanding, thank you.
Yes, great question. For those of you who are just joining, don't worry, we recorded the session and we'll be sending out the slides and recording on Monday. Just our program coordinator is out today and Friday, so she will be editing those when she's back in on Monday. And I'll note that the focus of our next roundtable, and so October's event, will be on walking through the Atlas survey that Leah described. So that's really our main source of data for Atlas. And so in advance of that event, you'll receive a reference copy of the survey, which, as Angad mentioned, the survey itself is online, so you can't submit the reference copy, but it's a great tool to use to complete all your answers ahead of time and then just type them in online. And we will at that time answer any questions you have about the survey itself. And so we highly recommend you attend. It will give you a good sense of what you'll need to do during the months ahead in terms of that survey. And as just a reminder, that survey takes about, sorry if you can't hear me, about an hour and a half, depending on the complexity of the services that you offer. And so you have 3 months to complete it. So if you want to break it out into 3 batches of 30 minutes each, certainly very acceptable. You can start and return to the survey at any time.
And I would just note that I have some questions about which contacts we have listed for your facility. So if you have questions about that, particularly if you have a large facility with multiple locations, please feel free to shoot us an email and we will confirm that we have the right people listed with the right emails for each of those.
Thanks, Leah. You can email us at atlas@shatterproof.org or at any of the email addresses up on the screen. There are no wrong doors to get to us. And I'm sharing the poll just because we've received 100% of the respondents have answered, which is great. So we know moving forward the ways that we can share this information with you. So we make sure that you and your colleagues are aware. Otherwise, we'll give about 2 more minutes for questions and then we can end early to give people back time in their day. Okay, so with 30 seconds of silence, I take it that there are no questions at this time. Again, if you do end up having questions afterwards, please email us at the emails above or at atlas@shatterproof. No wrong doors. And thank you for taking the time to join us today.
Thank you all. Have a good rest of the day.
Thanks, everyone.
And Brenda, I noticed you just joined. I'm so sorry. We are just finishing up because we had a very few questions, but you'll be getting these slides and recording in follow-up, as well as links to register for our future roundtables.
I don't know what happened, but I was on earlier.
Oh, I'm so relieved. I was like, I saw you in the waiting room and I was like, oh no, Brenda.
No, somehow I
Okay.
got in.
Somebody got in, got out, got back in. Love it.
Yep, I'm great. Thank you so much.
Anyone who's still on have any last questions? Down to 11 people. Kim? No? Okay.
I guess maybe one, it really doesn't have to, you might answer it later, or it might be in a sheet, but are the future webinars, are they the same login?
No, they'll be different. So when we send
Okay.
around the recording and the slides, you'll have links to register for each one. Feel free to just register for each
Okay.
month in advance. Yeah. And then I always save it to my calendar because you'll have that unique link.
That's what I was starting to do.
Yeah. No
Thank you.
worries. All right. Kaylin, do you want me to go ahead and end the
Yeah, I
Zoom?
think so. And I know, Angad, you messaged us, let's take a break and then reconvene.
Sounds good. All right. Bye.